All right. Thanks everyone for joining in today. So ladies, I'm so happy to have you here. Why don't you tell us all a little bit about yourselves and what you do?
I'm Katie. I am a certified nurse midwife and women's health nurse practitioner, and I am one half of the Push Revolution. I don't know what else you want me to say about myself other than that. I get really, really excited about postpartum information and education. Courtney and I could probably talk about it till we're blue in the face. So be warned, because we might be.
Yes. And I'm Courtney Amerin, and I'm an OBGYN and the other half of the Push Revolution. And Push stands for Postpartum Understanding, Support, and Health. We kind of created this company as a filler to the vacuum, the void of postpartum Googling. And honestly, in today's American, at least, society, you get a lot of focus on the pregnancy period, but nothing on the postpartum. And it's just kind of like, all right, here's some stuff to read when you get discharged from the hospital, and have a nice life, and call us at 6 weeks or come see us at 6 weeks. So we kind of wanted to create a space and place where, we can bring good evidence-based information from a midwife, from an OB. We have other people on too, obviously, like Eva's been on our podcast. And we also created a course to kind of transition people through postpartum. And yeah, so that's where we are.
I love that. And so how did the two of you meet?
We met at work.
Yeah.
Oh, okay. So how does it, because you see here, like I'm, as everybody knows, I'm Canadian. I live in Toronto, and the way that it works with OBGYNs and midwives here, I mean, I've been in the care of both of them, is, you either pick one or the other as your primary caregiver. And so the midwives have their own separate clinics, and the OBGYNs have their own separate clinics. And while they might know each other because they might both have privileges at the same hospital, they're not like working together per se, unless of course they have to collaborate. Sometimes obviously if there's a complication, a midwife will reach out to an OBGYN for a consult, but that's kind of the extent of it. So is the setup where you both live a little bit different?
Well, kind of. So it's still, we are, I'd say, we're both independent practitioners. We both have our own practice that we've been doing. And yes, we have the same thing of, if there's something abnormal, then I would consult with an OB. I don't know. Courtney, have you ever consulted with me? Probably not.
Maybe.
People want to have a midwife.
Yeah.
And so then I'll say, hey, you can take the station or whatever.
Yeah.
But I think what's really interesting is that there is that misconception that it is like two separate worlds. But I mean, our worlds overlap all the time. It isn't just like you either get to have the OB or you get to have the midwife, because I think a lot of people don't understand, like they do go side by side and they complement each other, and you can have either, and that's fine. So we've been having time. Yeah.
So you both work out of the same hospital when you say like you met at work? We
did. Yeah. So when we're at different companies now, we work at different places. But I was a brand new baby midwife when I met Courtney, and was just kind of walking around with my floaties on, like, what am I going to do with myself? And she was brand new as well. And so we just kind of bonded by disaster. Like if I laugh thinking about it, because if anything was going down, if shit was hitting the fan, it was because Courtney and I were both on together, and the universe was like, let's see if I can test you. So we bonded over that.
Amazing. Fantastic. Well, I'm so happy to have you both here because, my listeners are all in that postpartum period. They all have, either younger babies or even the older ones. A lot of them are in their first year postpartum. And so, I would love to hear from you both on, I guess, some of the biggest myths or beliefs, that deep-seated beliefs that you find amongst postpartum women that make you go, no, that's not true. That's really unhealthy. Don't listen to that. I guess if you could scream from the rooftops, like, don't do this or don't think that, what are some of those things?
I'm so glad you said that, because I feel like there are just a ton of myths when it comes to postpartum. First of all, I just want to say, when we're saying postpartum, this is a myth that postpartum is only about depression, right? And I think that if you were to Google postpartum, that's probably the first thing that's going to pop up. So when we're talking postpartum, we're talking about the period of time after you've had your baby. And, you know, in technical terms, it's the first 12 weeks after, or the fourth trimester. So that's something I just wanted to say right away. And then, yeah, we could probably talk about myths till we're blue in the face. But the very first thing I think that we hear a lot about, you know, a myth is that you're going to instantly fall in love with your baby. And while, or, you know, like, I'm going to fall in love with my baby, or I'm just going to be this amazing, I love being a parent. And I think that is a lot of pressure, right? That's a lot of pressure to put on yourself. And you might not, and that's okay. It's okay to say, I need a minute. Like, who falls in love with somebody the second that you lay eyes on them?
Yeah. Other than out of a movie.
Right. Yeah. And that's where people are getting a lot of facts from about parenting, childbirth, all the things, right? Like, we see that on the big screen and we think, oh, cool, my water's going to break. And then 2 minutes later, I'm going to have an intense contraction without an epidural and the baby comes flying out.
And then you're going to fall in love with the baby. And then you're going to get up and painlessly walk right out, you know, as if you didn't just push a 7 to 8 pound baby out of your body. And and then just go back to life being normal, right?
Right. And it doesn't always happen like that. And I remember I have 4 children, and my first one, I have a picture of the two of us sitting in the hospital bed, and I'm tucked in one side and she's kind of over here. And I'm kind of looking at her like, what am I supposed to do with this kid? I'd never held anything that little before. She was the first infant that I had ever laid hands on. And I just remember feeling super overwhelmed and like, I have to be in charge of this kid. She's mine. They're going to expect me to go home with her. And it's very overwhelming, that feeling of, I'm it. This me and you, kid, like, this is it. Let's fall in love. Let's do this. And it can take some time. And my second baby, I can close my eyes and I can still see it. I'm sitting in my bedroom and he's screaming his head off because all he wants to do is eat, as little babies want to do. And I'm exhausted. And I think, I don't actually like you right now. I love you, but I don't like you right now.
Yeah.
That feeling is overwhelming, and it's normal. And I think that a lot of times parents don't talk about how scary that is and how normal that can be. And it doesn't make you a bad parent.
Right. I mean, I'll just be honest. I don't think I fell in love with any of my kids the second. I've got 3. I don't think it was a love at first sight for me with any of them. It was kind of like, oh, okay. All right. So I'm taking you home. And then, all right, I guess you'll do. And then it's like, over time, you know, the relationship builds and the bond builds, like I think any other relationship, right?
Yeah.
So I agree. And then it doesn't mean there's anything wrong with you. It doesn't mean that, you know, you're like a cold-hearted, you know, witch. It just means that you just met this baby for the very first time who is 100% dependent on you for everything, right?
And on top of it, you have had this physical thing happen to you, right? Like, you may have had a vaginal birth or a cesarean birth, and that shit hurts, right? Like, it is not a painless event. And so you are human to be like, dang, I need a minute. I remember seeing, there was this Instagram post or something about like a picture of this person who had just given birth, and her baby she's on her hands and knees. Her baby is in between her knees, completely safe, you know, on this Chuck's pad and pillow. And it's very like a nice environment. And she's taking a minute. And the person that posted it was like, look at how amazing that this person is to say, I need a minute for myself. I have to catch my breath. This thing just happened. And then she scoops up and picks her baby up and brings it to her chest. And it's like, that is motherhood, right? Like, why can't we say, oh, I just need a minute. Like, this thing just happened to me. Let me catch my breath. And that, you know, I mean, gosh, think about like, Courtney, you do cesarean births all the time. You know, it's normal for that person to need a second, right? They're not instantly like, let me stand up and hold my baby and love this baby, right?
Yeah.
Like, we just need a second.
Right. Right.
Well, and you know, in the same vein, like we love to talk about the golden hour and skin to skin, but there's a lot of misconceptions out there that it's the hour, period.
Right.
60 minutes, period. And if you don't do it in that 60 minutes, you're never bonding with your baby, you know?
You're unbonded for life.
Yeah.
Yeah.
Because we posted a lot of that stuff on our, you know, about the golden hour, what skin to skin is, et cetera, benefits, you know. And so many people say, well, I didn't get that because I was having a C-section. I didn't get that because I had this happen, whatever.
Baby landed up in the NICU. Yeah.
Yes. But you can still do it for weeks after, you know?
Yeah.
Dad can do it. Partners can do it. Siblings can do it. Grandma and grandpa can do it, you know, like all of that is like a bonding experience for everybody. And the oxytocin flows no matter if it's the first hour or the 700th hour, you know?
Yeah. Yeah.
And
No,
that you can always do
100%. And I think it's important to emphasize that, you know, as I was saying before, like not every single birth goes 100% smoothly, that, you know, baby comes out crying and mom is okay. And you can do the skin to skin. I mean, my first birth was anything like that. And I felt really alone throughout the whole process. You know, I've shared this story before. It's not a secret. Basically, my complication-free first pregnancy, where I was, you know, 25 years old and, you know, my peak of health, I would say. What ended up happening is I gave birth at, I was about 41 weeks gestation, and baby was born with an Apgar score of 1, which in layman's terms, because I'll just say, I didn't know what an Apgar score was until my baby had a 1. The Apgar score, I guess you guys are probably in a better position to explain what it is, but I'll explain it using non-medical terminology, where it's kind of like the first test of that a baby ever gets to basically assess their overall well-being. So, you know, they're looking at heartbeat, at breathing, skin tone, reflexes, and what's the other one I'm missing? I'm missing a 5th one.
Movement, grimace,
reflexes, skin tone, heartbeat. There's a 5th one.
Respiration.
Yeah, that one. So basically, Amuna, my oldest, got a 0 out of 2 for all the categories except for the heartbeat, which was a 1 out of 2. And in North America, like a healthy baby is supposed to be born at the 1 minute mark, like a 7, an 8, a 9. And so she was a 1. She was completely asphyxiated, was, you know, shipped off to the NICU right away and was placed on a cooling pad for a 72-hour period. I forget what the actual medical terminology is, but they called it brain cooling, which was basically meant to prevent further brain damage, not knowing if there was any brain damage that happened. So spoiler alert, I'll just tell all the new listeners here that she's a perfectly healthy 10-year-old. But given the circumstances, we were warned very early on that there was a very high likelihood that she would develop cerebral palsy. And so naturally, through that whole experience, there was no bonding right away. There was, first of all, there was that separation. There was the immediate separation of, you know, being whisked off to the NICU nurses to do CPR, followed by whisked off to the NICU to get straight onto that cooling pad. Then after the cooling pad, she was whisked off to get an MRI done to see what was happening in her brain. And so she was about 3.5 or 4 days old before I was even able to hold her, with all these, you know, wires sticking out all over the place. And so this whole idea that I had, and so I really truly thought, like, gosh, I completely lost out. Like, I'm not going to be able to bond, because I had a number of friends that had given birth and around the same time as me, and they were all talking about their very typical regular,
Yeah.
normal experiences where like, oh yeah, I had to push for 2 hours and like the baby screamed. He was crying so hard. Like, and I'm thinking there was
Great.
silence in my
Mhm.
delivery room, like dead silence. And it made me feel very, very alone, thinking, I'm the only one to ever have this kind of experience, which I really wasn't, but it felt like that at the time. And B, I
Mhm.
really did think that it was going to affect the bonding that I had with her because I didn't have that opportunity to do the skin to skin and immediately hold her and immediately try breastfeeding. None of that had happened. Um, but thankfully, just like with any other relationship, the bonding happened. It just took a little bit more time. First of all, I had to
Yeah.
de-stress. I had to, kind of relax myself because thankfully, when things did start to turn around and she was making, really great progress in terms of meeting milestones and whatnot, we were able to relax more. But it didn't mean that I was never able to hold her. It just meant that I missed out on those few days, right? And at the
Yeah.
same token, I think of a high school classmate of mine who she developed preeclampsia at the end of her pregnancy and landed up in critical care. It was very, very scary. And so
Wow.
she wasn't able to hold her baby for the first few weeks because she was in the ICU. Her son is now 3 years old and they have a beautiful bond, right? But it's just one of those things that it takes time. And so I think that we all need to be a little bit easy on ourselves sometimes and, not aim for that picture perfect, Steven Spielberg movie moment that for
Yeah.
some people happens and that's wonderful. But if it doesn't happen, then either because of circumstances beyond your control or because it's just not how you're feeling, it doesn't mean there's anything wrong.
Right.
Yeah. Yep. Exactly.
Yeah. Um, Gosh, I just think that's that is like, yeah, we could write a book on that whole topic right there.
Yeah.
Um,
Yes.
Another myth I think a lot of people feel, and Courtney and I see this all the time, is at that 6-week visit, you're ready to have sex. Myth,
Yeah.
right?
Yeah.
Like, for sure, that's got to be. I mean, oh my gosh, I just think about what happens during that 6-week time period, right? Besides your body just going through this normal physiologic change of being pregnant to now being non-pregnant and going back to its pre-pregnant size on the inside, you've got all of these hormonal shifts. You've got these roller coasters of emotions that can happen. You are maybe trying to figure out how to feed your baby. Maybe it has come very natural to you. Maybe you've decided to formula feed. I don't know. But that is not an easy thing. It takes up a big portion of your day and your night, no matter how you're feeding your kiddo. And, sleep during the first 6 weeks is probably unlike anything you have ever experienced, right? Like,
Mm-hmm.
what other time in your life are you getting such fragmented sleep? Like,
Hopefully never.
yeah.
Yeah.
Yeah, I mean,
Hopefully.
like, for real, newborns will not be sleeping through the night. They will need to eat every couple of hours. If they've got any other special needs, maybe they need to eat a little bit more frequently. I don't know. Like, there's,
Mm-hmm.
anyways, you're not functioning well.
Mhm.
You're bleeding. You are leaking milk from your breasts. You are cramping. You are doing all of these things. And so when you get to that magical 6-week mark, are you ready to roll around with your partner? Probably not.
Probably not.
Even if like physically you are, like maybe you feel touched out. Maybe you're like, I'm good. I would rather have a nap. I'd rather have a shower. I'd rather you, I don't know, do something else around the house type deal. I don't know. I just think that one is a huge one.
Mhm.
And I've gotten many people asking, can you write a note? Can you write a note saying that I'm unable to for another few weeks?
Yeah. Yeah. I think partners are a little, and not always, obviously, but sometimes a little, you know, a misunderstanding of the clearance, because
Mm-hmm.
we're just clearing, saying, you don't have an infection, your stitches have healed, your cervix is back to normal. There's not something catastrophic happening that, you can't have sex.
Yeah.
But the mental component for females specifically, but some males too, is if you're totally exhausted and you're only worrying about this baby, you may not be into it. And that whole loop of like, you're ready, but you're not ready can really spiral with your partner too, and lead to this like, well, you don't want me, you don't like me, you just care about the baby. Like, where did my wife go, or where did my partner go, kind of deal.
Yeah.
And I think if it's, have that conversation, I always talk to my patients like, if and when you're ready, which is not what for me to decide, talk to your partner, use lube, go slow, but I'm just here to say
lube. Yeah, lube has got, Courtney and I could talk about lube all day long, and we have talked about it. But lube, unfortunately, is one of those things that has a negative, air around it, where people are
why
like,
is that?
You
like,
have
what's
to use
wrong with it?
You must be old and like, but no, like, it's not. And it can make things a lot more enjoyable and less painful. And if you are lactating, if you are nursing your baby, or you're pumping, you're producing milk, your body has a decreased level of estrogen, which means that those vaginal tissues may be a little bit more tender. You might be more at risk of having tears, little teeny tiny micro tears. It might feel like your vagina is on fire. So I can't tell you the amount of people that I've seen that have said, I'm pretty sure I have an infection, and there's no infection. It's just that their tissues are dry from lifting their baby. And so lube and foreplay, time and space, that's really the ticket, right? Not the magic 6 yet.
Yeah. And let's not also forget that in the United States, I mean, a lot of the women are back at work after 6 weeks, which as a Canadian, I'm just going to say for the record, that is batshit crazy. Just going to say, like, there's
terrible.
Nothing else. I really, truly thought that it was one of these, old wives' tales. Like there's no way they're actually back at work after 6 weeks. Like they must all get, 5-6 months. Like, it is the United States. And then it was, it was when when I was pregnant with my first, my sister-in-law, who's American, was also pregnant with her first, and she's a teacher. And we were both we ended up having girls a day apart from one another, which is like really cute. And so, and it was in May, and she was really excited because, by the time she would have to go back to work, it was summer vacation. And so she wouldn't have to go back. She would have a full 3 months off. And I was going, what?
Yeah,
you're celebrating over 3 months? And she goes, well, yeah, otherwise I would get 6 weeks. And I was like, my jaw fell to the floor, because happens to be at the same time, I was going to be going back to work when my daughter was 5 months, because I had her right after finishing law school. And so here in Ontario, you have to do what's called articling, which is like a paid internship as a requirement to get called to the bar. And so I miraculously landed a dream articling position, 7.5 months pregnant. Don't ask me how that happened, because I still to this day don't know. But they were willing to work with me because they knew who they were hiring. And so they let me start a few months later so that she was 5 months old. And so as a Canadian, I was feeling so much guilt going, oh my gosh, I'm going back to work after 5 months. Everyone else here goes back to work after a year. But then hearing my sister-in-law celebrate 3 months, I was like, okay, perspective here. But at the end of the day, whether it's 6 weeks, 3 months, 5 months, like, it's still bloody exhausting. And that's going to affect your sex drive as well, when your little one is not sleeping through the night necessarily, or even if they're waking up, once or twice, which is normal, it's still exhausting. You're still not getting completely uninterrupted sleep at that point. And then that's going to affect how you're feeling, right?
Yeah. 1000%. Definitely. Yeah. It's kind of ludicrous.
So don't be hard on yourself, ladies.
Yes, definitely.
Do you have any tips for how these moms can approach that conversation and have that delicate conversation with their husbands who just might not get it?
Yeah. We just did a podcast. We spoke with our good friend, Dr. Jenna, and we call her a sexpert. She is amazing. And she talks a lot to couples about this very topic. And her best advice on this is to start communicating during pregnancy. Like, these are my needs right now. Let's talk about it. Let's be aware that my needs, your needs may change once this little one is here. I mean, everything is very hypothetical before you've done it, right? Like, I was the best in the world before I had my children. And, you know, now I'm like, okay, cool. Like, talk about humbling. And that is what kids will do. I mean, everything is very humbling. Your relationship will change, not necessarily in a bad way, right? It can be amazing. It can be life-changing. It can be so good. And so, yeah, communicate, start talking about it now. And then if something isn't working, say it. Like, don't bullshit. Just, you know what, this isn't working for me, or let's come back to this tomorrow or 2 days. Like, take that pressure off, right? So that you don't have this. Like, I just remember when I was a midwife student, looking out in the waiting room once, and there were several partners hanging out kind of all together, and they were like anxiously waiting while their partners were doing their postpartum visit. And all I could think about was like, you are waiting to hear, we can have sex tonight.
Yeah.
And
Am I going to get laid? Yes or no?
And, you know, like, I think some of that also is stereotypical. You know, like, my partner was very tired at that 6-week mark as well, because I didn't let him off the hook. He got put to work. He was working full time, and I made him get up as well and help with his share with the kids. And I don't regret that at all. We both were tired. We both shared the load of it. And, you know, it was good because that pressure was taken off. And I think that's what you just have to do. And everybody's different. Every situation is unique. You know, what works for one person isn't obviously going to work for another person, but I think there's some fair things to try.
Yeah. I have a colleague, you know, she's a registered psychotherapist. Her name is Allison Villa, and her specialty, I'm just giving her a shout out because she's wonderful. And her specialty is she helps couples remain connected after having a baby. And she talks about how it's so normal for relationships to go through various different seasons. And some of those, you know, more challenging seasons are completely unavoidable, you know, and like being in those first postpartum weeks and months is just naturally going to be that more challenging season where, you know, you might not be able to spend as much time with one another as you normally do because you're flipping tired. You have a newborn that's taking up a lot of your time. And it doesn't mean that it's forever. It just means it's a season. It's a season, and, you know, seasons don't stick around forever. Your baby isn't going to be a newborn forever, but it just kind of comes with the territory of having a newborn. And I think that when people recognize that, instead of trying to fight it, like, well, no, life should go back to normal because the baby is 6 weeks right now. I think it's easier on everyone, right?
Yeah.
I think also a huge thing that plays into your sex drive is your brain, right? So if you are, you know, expecting that immediately post baby, your body's going to look like what it did before there was a baby in it, that's a little bit of a mind fuck. It is like your body's different. Your body's changed. You have grown a human being. And, you know, I think that we put a lot of pressure on ourselves and on other people who have given birth to immediately jump back and look amazing. I mean, look at when, what's her name? All of the duchesses who have given birth and they step out in their white dresses and their teeny tiny waist. And it's like, what?
That's not normal.
Yeah.
It isn't normal, and it's okay. And I think that we put a ton of like expectations that you're just going to look and feel amazing. In reality, you might not recognize the person that you see in the mirror. You might take your clothes off at the end of the day and go, oh, who is that? That's not what I looked like in my head. And, you know, there is nothing wrong with how you look postpartum. There really isn't. And it's okay to have these changes, and your body is going to go through more changes as more time goes by. And so I think that also can play into the way that we feel about wanting to have sex with our partners. And yeah, I could talk about that all day. Sorry.
No, I
Well, and
think
that
that's a big
kinda
one.
yeah, and that leads into another myth too, that your body's just going to bounce back, and then if you breastfeed or lactate or nurse or pump, any way that you're making human milk, your body's just going to lose the weight like this, and
Yeah.
it's you don't even have to do anything, you just lose the weight because it's going into the milk. And some people it is like that, but a lot of people you hang on to that 10 pounds or so because that's what your body has in the reserve because it knows that it needs that because you're breastfeeding
Yeah.
or lactating. And a lot of times people can have a very disappointed 6-week visit, so to say, that
Yeah.
like, what the hell? I lost all this weight and then now I can't lose anything. And, even if you're not breastfeeding, that can happen too.
Yeah.
And, it's took you 9 months to get here. It's going to take you 9 months to get back or more. And that's fine. Or
Okay.
maybe never, and it's not really a bounce back for more than a bounce forward into
Yeah.
the new you, the new life, and
Right.
things like Katie said, things are going to change. Like your hips are always going to be wider, period. Even if you had a C-section, because the hormone relaxin is working anyway. And it relaxes all those joints. And that's why people get a lot of pelvic pressure and pelvic pain right before they deliver. And your body doesn't know that you're going to have a C-section, so your body can be different even if you don't have a vaginal delivery.
Yeah.
Yeah.
That's true. Yeah. And I have a girlfriend. We had a baby on the same day. And I was one of those that with my baby, I did lose the weight. And she didn't. She gained it. And it was like this weird competition of like, okay, we had our baby at the same time. We gained the same amount of weight. Why do you look like this? And those hormones postpartum can really mess with you where you're like, oh, I have to look like this. I got it. I don't know why we do that to ourselves, but don't do that.
That's diet culture for you, unfortunately. Yeah.
Yeah.
It's not your friend's fault. Your friend, just like almost every other person in the world, unfortunately, is just a victim of diet culture. And diet culture permeates itself in the world of postpartum, where anytime any celebrity has had a baby, the first thing that the tabloids and these magazines want to
Mhm.
know is, oh my gosh, how did they lose the baby weight?
Yes.
Yeah.
That's all that they know about. And I know that, I don't know if either of you follow, oh my gosh, what's her last name? Jessie Cruikshank. I don't know if you follow her.
Mm.
She used to, you know what? Because she's Canadian. She now lives in
Oh.
LA, but she used to be on like eTalk Canada. She
Okay.
has twins. She actually just had another baby, a singleton, but she also has twin boys. And I know that she spoke about the fact that she's naturally very thin, and she got pregnant with twins, and it looked like after a short period of time her body just kind of more or less went back to the way it looked before, which was very slim. And that's all that these journalists wanted to know about. And she was going, do they really not want to talk to me about anything more substantive than that? Like, does nothing
Right.
else matter? Like, I gave birth, I grew two babies in my body. And she's very open about the fact that it was actually a very complicated twin
Mm.
pregnancy. They're identical twins. And there was, I think, what is it called? Twin to twin
Twin
syndrome. Like
transfusion.
she had,
Uh-huh.
yeah, like it was a very, very
Wow.
complicated situation. And no one wants to talk to her about the transition to motherhood, how it's going from having no babies to two,
Yeah.
how are you surviving? What kind of support do you have? No, we just want to know how you lost the baby weight. You
Yeah.
back in your
Yeah.
skinny jeans. What the
Mhm.
hell? That's a
Exactly.
problem.
Yeah, definitely. Oh
But
yeah,
again,
I
I
get
think that that's diet culture that is just everywhere, that
mhm.
permeates in every aspect of our lives, including postpartum. But I think that what makes me so protective over these postpartum women is the fact that they just grew another human for, on average, 9 months, gave
Mhm.
birth to it, and are exclusively responsible for keeping it alive. Okay, fine. Presumably the partner is helping them out as well. And to be putting that, and their hormones are totally out of whack. And then to be taking diet culture and putting that level of pressure on such a vulnerable group of people makes me want to scream.
Yes.
Oh yeah, for sure.
I love that you said vulnerable, because that is really what postpartum is, right?
Yeah.
It is stripping away everything that you ever thought of yourself, and your relationship and your reserves and all of these things, and just being vulnerable. And that can be really hard for a lot of people, that, giving up control, that giving up all of the things can be really hard. It can be a lot. Yeah, it's a lot of pressure.
Mm-hmm.
Amazing.
And all of that, and the crashing hormones and everything, is what predisposes everybody to, well, almost ubiquitously, you're going to have postpartum blues. Like, who cannot?
Mhm.
Yeah, and that's another myth, though, right? Like that it is a normal thing to be depressed, but like Courtney's saying, it is a normal thing to experience the postpartum blues, but not so much to have postpartum depression.
Yeah. And I think women just get told, or birthing people, and partners too, like, welcome to parenthood. Like, this is how it is. You're going to feel like shit. You're going to, not get any sleep. You're going to, feel down. You're going to worry about your baby because you're just a mother now. You're just a parent now. You're just a dad now. But there is a time when it becomes pathologic, or like a diagnosis where, like, no, this is actually a thing. This isn't just baby blues, or I just didn't get enough sleep, And I think that especially women, because that's just like how we've been told in our lives, that like, you're being hysterical, you're being ridiculous.
Right.
And like, no, actually I'm not, because like, I just had a baby and all my estrogen crashed and I haven't slept and my boobs are leaking, and no, like,
and I grew human over the last
like,
9 months. Right.
Yeah.
And no one ever says that. I'm just going to say, I know we can go down a deep rabbit hole when we talk about like the feminist aspect of things, but nobody ever calls men hysterical.
Right.
No. It's really interesting. I was just listening to a podcast today because my commute to my job allows me to have 30 minutes of uninterrupted time. So I was listening to this podcast that I adore. It's the Armchair Expert, by the way. Courtney knows.
Oh yeah, I love that.
With him. My goal, we're going to get a pair of armchairs and just hang out. But he was, I don't even know who he was talking to, but he was talking to this man. Oh, it was Justin Timberlake. That's who it was. And they were talking about how you, as these dads now, like, they have this weird role where they are not allowed, or have been taught that they can't show their emotions. They can't do these things. And then on the other hand, they're being told by society, like 50-50, that actually you should be showing your emotions, and you should be saying these things. And so they're like, like, I want to let my guard down, and I want to cry, and I want to do all these things, but I got to be manly, and I got to do all of these things. And I mean, I feel like that's kind of where we're at right now with these postpartum people and their partners. Is very polarizing, right? Like, we hear from our parents and our grandparents to be one way, and then we see in society to be another way, and then with our friends and families we're another way, and it's like, what do we do?
Yeah, definitely. And I think, especially men, but other like non-birthing people in general, it's like, if they change a diaper, it's like, oh my God,
you're that
so helpful.
Yeah.
Like, no, it's 50-50. It took 50-50 to get here. It's 50-50.
Yeah. No, I always see, I can't
it.
remember the last time I saw this meme of like this guy. He himself, he's a father, he's got a toddler and a baby. And I think he was giving his wife a break, and he took the young kids to the grocery store by himself. And he had all these people coming up to him going, wow, you must be such a great dad. Like, look at you taking your kids to the grocery store. When was the last time a mom got the same compliment by taking her kids to the grocery store by herself? Never. Never.
Well, in the same vein, they say like, when fathers are out or whatever with their kids, it's like, oh, you're babysitting.
I was just gonna say that.
You're babysitting.
I'm parenting my children.
I'm just being a parent.
Yeah, like
right. But I would love to just delve into, the postpartum depression and anxiety a little bit more, because I think it is important for people to understand, where would you say, like, where's the fine line between what is normal baby blues, regular hormonal fluctuations that with time will eventually kind of level out, versus something that should require more intervention, something that's not just baby blues, that's, more serious, like actual PPD, PPA. How does one know whether or not they have one or the other?
Yeah, so it can be really confusing. Like, I'm just going to be real honest with you. I have had all three of those things.
Yeah.
Postpartum, the baby blues, we say this all the time. It is a natural, normal phenomenon that your body is just going to go through. Your hormone levels were very high during pregnancy, and then they become very low after the baby and the placenta is out. Normal, normal, normal. But just because it's normal doesn't mean it doesn't feel like shit. Okay.
Yeah.
So you can be like, some of my triggers where I would just be hanging out watching TV, nursing my baby, and all of a sudden I'm like, oh my God, I have to cry about this. I'm not a crier, but I would burst into tears about the dumbest stuff.
Yeah.
And then I would be like, wow, that's weird, but I'm okay. That lasts for about 2 weeks in the postpartum period, in the immediate postpartum period. Postpartum depression is a sneaky bitch. It will come at you and you just feel, it's not sudden, right? It's kind of this slow growing thing. And, it feels like it's kind of always hanging out behind you. It makes you, it steals your joy. It steals away all the good pieces. It makes it so you cannot enjoy or function through your normal everyday activities. Everything feels too much. It feels too hard. It feels overwhelming. It isn't always obvious that it's depression either. Sometimes it can be anger. Sometimes it can be, all I want to do is sleep, or it can be, I can't sleep. I can't eat. I can't do these things. So it can be really frustrating, especially if you've experienced it in the past. Doesn't mean it's going to show up the same way. Anxiety is, it feels like what you would expect anxiety to feel like. You can get a racing heart. You can have racing thoughts. You can have a hard time concentrating. You can have overwhelming thoughts. If you are experiencing those, anxiety doesn't have a timeline. Anxiety can show up during pregnancy. It can show up after immediately. It can take a little while, but if you're experiencing those things, you need to ask for help, because identifying it, calling it what it is, and getting treatment is possible.
Yeah.
I think, especially with the depression and the blues, the main thing is that, like, you can't find joy at all with postpartum depression. And that's really the hallmark, and it being after 2 weeks of delivery.
Right. And then at what point do you find that those overall postpartum hormones, like we're not talking the first 2 weeks, but like even just, as you said, like crying at the drop of a hat, right? Or talking about something emotional that might have not necessarily landed in tears, but like gets you into tears. At what point does that usually kind of level out? Can that continue if somebody is still breastfeeding? That, those hormones can just make you more emotional, or, what's common, I would say, what's to be expected with that?
Well, what I think is really interesting is that if we historically look at ourselves as estrogen producing people, so I'm just going to say women, when our levels go up and down throughout our life cycle, when our levels are nice and low, we feel terrible. So we feel like that throughout our monthly cycles. We feel like that in the postpartum period. We feel like that during menopause. And so it can be really normal to have those feelings of depression and anxiety. So when you are breastfeeding, your estrogen levels are definitely nice and low so that you can produce the hormone to produce milk.
Mhm.
So yeah, I think that if you are nursing your baby, chances are that your moods are probably going to be a little bit more, I would say, unstable compared to
Mhm.
if you are not. And another factor that plays into moods is what do you have for support? Are you doing this all by yourself? Are you taking care of 1,000 other things in your house, other kids? Are you, trying to do X, Y, Z? That's a big deal. And another thing that I think that people don't put a lot of stock into is that lack of sleep. And I know that you know
Mhm.
about this,
Yep.
but if you are not sleeping, your chances of having a mood disorder go way up, right? Like
Yeah.
if you're sleeping terribly, you probably feel terrible.
Mhm. Oh, 100%. I mean, we know that even with even outside of the postpartum sphere, we have so much research that's been done on just sleep in general. And when anyone, of any gender, of any age is not sleeping, is not getting that consistent uninterrupted sleep, the chances of struggling with regards to their mental health in terms of depression, anxiety, or whatnot, like the risk goes up dramatically.
Yeah.
Um, and we know that. I mean, that's one of the many reasons why I'm so passionate about what I do, because I know that this is more often than not like precisely what exhausted moms need to be able to feel like themselves again, is to be able to get a proper night's sleep and to teach their baby to sleep like a champ, which, don't get me wrong, it's not possible to get a newborn sleeping 11 to 12 hours at night. But if your little one is 8 months and is still waking you up all night long, like that can absolutely be fixed. Or if your 4-month-old is waking you up 5 times a night, we can get that 4-month-old down to one wake up. And that could very well be the difference between someone really struggling with PPD versus being able to get it under control. In fact, I have a number of colleagues who are psychologists themselves who specialize in the perinatal mental health sphere, and they tell their sleep deprived clients, which are almost all almost all the moms that come into their office are sleep deprived, and they tell them, you need to go work with a sleep consultant. Like, we need to get your baby sleeping. I want to be able to help you, but we're going to end up hitting a brick wall if half the reason why you're struggling with mood and struggling with anxiety and struggling with depression is because you're not getting enough sleep. So
Mm.
yeah, I mean, listen, that's something I can scream, off the rooftops. I just, with regards to the mood itself, I have this really clear memory, and it was a little bit embarrassing. So I was 4 months postpartum with my son. And basically the context here is I was at this get together of a bunch of moms of my oldest is now she's just finishing up 4th grade. So this was a couple of years ago where they were all entering. It was like moms from her school of kids that were all entering grade 3. And the reason why we were all getting together was because my kids go to a Jewish private school. They were different campuses. They were amalgamating some of the campuses together. And so there was going to be a whole bunch of new kids in their school from the other campus going to the campus that my daughter was at. And so we had to get together, have all the moms meet each other, so that we can make the transition go as smoothly as possible. And so we were all sitting around, and the person who organized it said, okay, why don't we all go around, introduce ourselves, and say your daughter's name and why you named your daughter that name. Because a lot of Jewish names have very strong, like Hebrew Jewish names have very strong meanings to them. And my heart starts to beat. Why? Because my daughter is named Amuna, which in Hebrew means faith. And so we named her that because of the story that I just shared with you. I'm 4 months postpartum, exclusively breastfeeding my son, and I'm going, I've never met half these moms before. Don't cry, Eva. Don't cry. Don't cry. Don't cry. And I'm trying to keep myself together. And the problem was that I was the second person to go. I was like this. So there was one person, next to me, and she's like, hi, my name is so-and-so. I named my daughter Shira because we like the name and we named her after her grandmother and blah, blah, blah. And I'm going, okay, now it's my turn. You can do this, Eva. You can do this. And then as I'm talking, and I'm just like, I'm calm. I got this. Like, no problem. I'm just going to say that there were some complications and blah, 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 blah. And then as I'm talking and my brain is calm, but I feel the tears well up in my eyes, and I'm going, and I'm just like, why am I doing this? Why is this happening? It was like this weird bodily experience. It's called hormones. Let's call this spade a spade. It was called hormones. And then I'm a redhead. And so I blush very easily. And so, because of course, then I start to cry, and then I'm embarrassed because I'm like meeting these moms for the very first time the kids are going to be in my daughter's class. And I'm going, oh my gosh, this is literally the worst thing ever. I really should have said pass. Let me go around and I'll come back. But anyways, what ended up happening was I actually had like 5 other moms come up to me being like, I had a similar situation. That was what happened with my daughter. And I had my daughter also landed up in the NICU. So I invited, because then what ended up happening was everyone else started sharing their NICU stories and they started crying. And I'm going, oh boy, I'm not quite sure the organizer intended for this to happen. But at the end of the day, I guess that's what happens when you ask what was, I guess they thought it was just like a neutral question. They thought all the answers would be, oh, she's named after her aunt, or she's named after her grandmother. But there were enough of those stories that didn't fit that mold that just had half the people who are all postpartum themselves landing up in tears.
But isn't that
good times?
That just proves the point that we need that support postpartum. We need that community. We need to be able to tell our stories because they are so powerful and so important. And I imagine even 10 years later, you still probably get teary and you still probably get goosebumps thinking about it. Because
totally. I'm a little bit teary-eyed right now, and I'm not the least bit postpartum. There's 0 postpartum hormones in me that I'm aware of.
Yeah.
So I agree. Like, again, we all need to be really, really easy on ourselves. But I think that gives women some clear guidance in terms of when you can just actually chalk it up to like temporary postpartum hormones that are nothing to be concerned of, versus if there's something more ongoing where, you should go and speak with somebody about. And who would be that person to reach out to? Like, if let's say you're past the 6-week mark and you're no longer in the care of your midwife or OB, is it your family doctor? Do is that the next person to speak with?
That's a really good question. In fact, my colleagues and I were just talking about that today. It is a gray area because for a lot of people in the maternity world, the OB providers, the OBGYNs, the family practice people, the midwives, we are basically the only people that they see throughout this time period. And so who better for them to speak to than the person that they've been seeing, right?
Yeah.
So I can't speak for Courtney, but my training that I had was to become very comfortable. I took extra training so that I would understand the postpartum mood disorders, because it isn't, unfortunately, something that we are taught in school. So I feel comfortable screening for mood disorders and treating. And also I feel super comfortable referring when it is outside of either my scope of practice. So if somebody is coming with OCD, or perhaps they have bipolar, those would be reasons why I would want somebody else to be involved. And so I will do that. And I know Courtney refers as well. She talks about that all the time, about how she's not an expert in everything, but it never hurts to ask, right? Like call the front desk and say, hi, I am a patient and I am this far postpartum and I'm struggling. And they will either say, come in at this time, or they'll say, actually, why don't you call your PCP? And if you don't have one, try this person.
Mm-hmm.
Yeah. I think, always starting with your OBGYN or your midwife is fine. If you've ever had a therapist in the past, you can ask them as well, or, any therapist that is covered under your insurance. Of course, I don't know how that works in Canada, but
Yeah.
in the United
It's
States,
all
like,
public
there's,
here.
yeah. And in the United States, there's like some that are covered, some that aren't,
Yeah.
You can always reach out to a therapist without a doctor knowing, it's not a prerequisite.
Yeah.
And if your insurance really wants that for coverage, then okay, but like you might as well try, initially. And we always say that, having that person, the therapist or whatnot, because, any mood disorder or anxiety disorder is always going to be helped with therapy, like bar none.
Mm-hmm.
There's nothing that can't be. There's no disorder that's only medication treated.
Right.
And so we always recommend both. And having that person on hand, their number on the refrigerator prior to birth can be really helpful, because then like this person is in my network, they are nearby, they're what I want, whatever. And then if the need arises to call them, it's right there.
Yeah. Yeah.
And even meeting with them prior to delivery to just kind of like have a baseline session. And a lot of therapists do like free 15-minute introduction or whatever. But yeah, so, and then if your provider goes like, you're probably fine, that's because they don't know and they don't want to admit that they don't know.
It's
Right.
okay
So
to
just
get
find
another
another provider.
100%.
Yeah.
Right.
And a lot, like I would say 99.9% of obstetric providers in this day and age are not solo providers.
Mm-hmm.
It's a little insane if you're a solo provider. You have to be in a group basically, unless you want to be on call 24/7.
Oh gosh. Right.
Yeah.
And so the two of you will both see patients past the 6-week mark if they're struggling with, something postpartum.
Yeah. And what I think is really interesting and cool about childbearing is that you oftentimes will bond with your provider or that practice, and you will go back to them, right? You have more babies, you have gynecological needs, you need birth control, you need whatever. Those are going to be the people that you're going to see. And so we want you to, right? We want to see you if you're struggling.
Yeah. No, that's so nice to hear. I mean, I don't think that's actually how it works here in Canada, unfortunately. I think that
Yeah, it
here
might not.
your first line of defense is your family doctor, which if you have
And that's
a
fine,
good
too.
family doctor that you trust, that's wonderful. But I know a lot of people who don't have, either they have a family doctor, they don't see them very often, or they were in the care of a midwife or an OBGYN for 9 months. And I think that if there was that bond there, then it makes sense for that person to be the first person to reach out to, because they feel most comfortable with that person, right? There's a relationship there. So that makes sense. And you know what? I'm gonna ask around, ask my people how it works here, in Canada. If is an OBGYN allowed to bill OHIP, like bill the government, to meet with a patient after 6 weeks to discuss, postpartum mental health issues? I wonder. I don't know if they're.
I mean, think about it. Like, not all of the mood disorders are going to happen within that first 6 weeks.
Yeah, no, you're absolutely right.
8 weeks out, 12 weeks out, 14
Yeah.
weeks. It doesn't have a timeline like that.
Yeah. And I think it's also important to point out that a lot of people think that the only people who end up with PPD or PPA are people who have struggled with depression or anxiety in the past.
Right.
Now, don't get me wrong, that's obviously a risk factor, but it doesn't mean that you're then, exempt from ever having a postpartum mood disorder afterwards. I mean, these hormones are really, really powerful. And I know people personally who have struggled hugely with their health, with their mental health postpartum, who had never struggled with depression or anxiety in the past. And that's all within the realm of normal.
Yeah.
Yeah.
Yeah. It does not discriminate. It does not.
Yeah.
Yeah.
There are risk factors, but it could be anything,
Mm-hmm. This was amazing. So let's sum up here, because I know there were like multiple truth bombs. So I always like to, summarize things at the end. So, the biggest myths, remind me again, what was the first one that we spoke about?
That you're going to love your baby right away.
Yes. You're not going to necessarily love your baby right away, and that's okay. Doesn't mean that your heart's made from charcoal. It just means that you're very, very human. The second one was sex, right? That you might not want to jump into bed with your husband the second you get the A-OK from your doctor and midwife. And that's also okay. Number 3, your body's not going to necessarily bounce back to the way it was before, even though diet culture might tell you that that's what you should be aiming for. We should all be giving diet culture the middle finger here. And number 4 is what we were just talking about, like to recognize the signs of, PPD and PPA, and ultimately acknowledge what is normal given what your body has gone through and given the natural hormonal fluctuations that are going to cause all kinds of mood swings and fun, really fun stuff postpartum. That's, again, all within the realm of normal, and knowing when to reach out for help. So this is so huge. Thank you so much, the two of you, for coming on. So if people want more of you in their lives, where can they find you?
So we're on most of the socials. The Instagram handle is postpartum.push. Facebook is the Push Revolution. And then we have a podcast as well, which is the Push Revolution podcast. And that's on Stitcher, Spotify, Google Play, and iTunes. And then our website is www.postpartumpush.com. And there we have some freebies. We have our blogs, we have our podcasts up there as well. And then most importantly, we have a course about postpartum. So that walks you through pretty much everything we could ever think of for postpartum. And that's on our website as well. Your podcast, of course.
Amazing. And I just have to say that I really feel like your course that you offer was something that I needed so badly after having my first, given how alone I felt with, my whole specific unique experience, feeling like nobody else in the world was going through what I was going through and what my husband was going through. Oh my gosh. I really, really, really needed your course. So you guys should really all check it out, because I agree. There isn't enough support for women in that postpartum period. So, you got it. We need, there's a reason why we all need a village, right? And this can absolutely be part of your village. So thank you, ladies, so much for being here. And thank you all for listening in.